Hospitals are overwhelmed and child care services are feeling the impact of RSV cases. Bola Badabo is here with a closer look at what's going on.
Hospitals are full, emergency departments are full, nurses are spread thin, and daycares are experiencing a decline in attendance.
It seems almost pretty much every child at our daycare has now had RSV or currently has RSV.
Munchkin Manor Daycare in Bend cares for 22 kids. They've been treating the crisis similar to the COVID-19 protocol.
Lots of hand washing, sanitizing nonstop, monitoring. We're pretty much doing daily health checks with the children, checking temperatures.
According to the CDC, RSV is most infectious between 3 to 8 days. Symptoms include a decreased appetite, a runny nose, coughing, sneezing, a fever, and/or wheezing. Dr. Wendy Hassan, the medical director of pediatrics at Randall Children's Hospital, explains in a Thursday's OHA meeting why the healthcare system is under severe strain.
I want to be clear that the crisis that we're dealing with in pediatrics is a crisis of a lack of healthcare personnel, a lack of respiratory therapists, nurses, and support staff.
Governor Brown responded to the rise in RSV cases along with COVID-19 and influenza cases with a new executive order. It expands her November 13th emergency declaration to address the healthcare worker shortage crisis. She wants to provide additional flexibility to Oregon hospitals to bring in enough healthcare workers to meet current needs. A registered nurse with St. Charles Bend says she appreciates more support, but there's a downside.
When she declares these state of emergencies, the checklist of how she states them and what that means are pretty broad and general.
And that can turn into double patient loads for staff. Megan Bovey, working in the pediatrics unit, says they need more bed capacity, staffing, and other resources.
A long-term solution, we need to be set up for our booming pediatric population. We need more of a pediatric facility.
OHA plans for more staffing with $25 million in additional state funding. They expect more than 100 contract nurses and respiratory therapists to be in place in the next week. One doctor in the OHA meeting says there's been a 5-fold increase in RSV hospitalizations in Oregon between October 23rd and November 13th. In Central Oregon, OHA records 271 RSV positive tests as of yesterday, and this map reflects the sudden spike in cases between October and November.
At least on my shifts, I'm seeing between day 0, so literally day-old babies, to age 5 are getting hit the hardest.
OHA officials warn against exposing yourself and children to crowded indoor places like restaurants and grocery stores. Dr. Wendy Hassan highly recommends kids get the flu vaccine to keep them out of the hospital. RSV does not just affect kids, though. Adults 65 and up, those experiencing pregnancy, and the immunocompromised are also at risk. Bola Badabo, News Channel 21.